I am Caleb Mootispaw, and I am a senior at Asbury University, and I have cystic fibrosis. A typical doctor's visit starts out with me going into the vitals room, and they check out everything from blood pressure to my height and my weight to just asking me how I feel, how I've been doing, if I've gotten sick. And then I will go and take what's called a PFT, or a pulmonary function test, in which I blow into a computer and they read on a scale graph with numbers my lung function. So they're looking to make sure that my lung capacity is still fine, and that I'm breathing well, and that I'm growing still, and that if I'm not growing more, then finding out why and what could be stopping that, whether it's nutrition or malnutrition or lack of exercise.
Cystic fibrosis is a genetic disease. It's present from birth. It is primarily affects the lungs, because what it does is it affects the ability of the lungs and other tissues in the body to get water from inside the cell to outside the cell. And so in the lungs, what that means is that the normal mucus that's nice and thin and easily cleared out by the lungs is very, very sticky, gets stuck in there, gets bacteria living in it that the lung doesn't normally clear out. And people with CF then have chronic bacterial infection in their lungs, even when they're very, very young. Usually within a month or two, they have some bacteria that lived out there.
I wasn't really expecting anything of a life-threatening disease by a long stretch. I felt very responsible for Caleb's illness. You know, I was a part of that. I'm the one that passed it to him, and so I felt very guilty. Afterward, I was very shocked, very distressed, didn't know what to do, very scared is how that I felt.
I found out I had cystic fibrosis when I was 5 years old, so in 1999. When I was 5 years old, I did not really think too much about it. I just kind of knew that there was something different, and that I was not like a lot of the other children, and that I had to miss school sometimes for a doctor's visit, or I had to do chest therapy treatments and spend 30 minutes a day on a vest and taking multivitamins and pills.
Dr. Miser, his pediatrician, referred him to the doctors in Cincinnati, and they run a series of tests. In those tests, it came up positive for CF.
So I knew as a 5-year-old that I had something different about me, that this was a thing, but I really just lived as if I was any other child.
That's it. Relax now. Relax.
I remember hearing from one of my older brother's friends about this sport where the coach drives you out 6 miles out into the country and drops you off, and you have to run back into town. And I thought that was the coolest sounding thing ever. I was totally in for it. And so that summer I went to the practice and I tried out, and I just fell in love with it. I did really well. We did an easy 2-mile run, and I just thought it was really fun, and it took off.
One of the standard therapies we recommend from birth for people with CF is to have some sort of procedures done to help them clear that sticky mucus out of their lungs. So that may involve pounding on the chest when children are very small. It involves using a vest or a vibratory thing to help vibrate the mucus loose, and then mechanisms to help cough it out, which is kind of in addition to the vibration, you shake it loose, but you still need to move it and get it out. Running does all of those things. Running involves some pounding, so there's vibration. It involves much deeper breathing than what people normally do, and And as a result of that, it tends to get air behind the mucus, clear the mucus out, and keep the lungs expanded and healthy. So running is really one of the very best things that people with CF can do.
I want people without cystic fibrosis to know that they're able to do whatever it is that they put their mind to. That hindrances, whether physical or financial or emotional experience, doesn't have to stand in the way of their goals or their dreams and their desires.
I think that Caleb's ability to run the way that he has ran is a gift from God. Definitely didn't get it from me or his mother, but just for that determination, I believe it was from God, and I think that it has been a big factor in keeping Caleb healthy, keeping his airways clear.
I think something that everybody should know about everybody with CF is that the burden of care is huge. To help keep healthy lungs, to help maintain weight, people do 1 to 2 hours of therapy a day, trying to shake the mucus loose, trying to get it out, taking aerosols, sometimes antibiotic aerosols, and it's critical that people to do that. If people can do, at least for some of those, something that's very healthy, such as running, it helps in other ways. You know, if they can substitute running for one of those therapies a day, that has a lot of benefits. It provides the exercise and cardiovascular conditioning, as well as helping keep the lungs cleared out.
Before I can even remember, I've been running around telling my parents,
Hey,
look, there's an airplane, and watch me run, Dad, watch me run, Mom. And so I feel that this has been a part of my life before I even realized it. That's why I'm moving forward.